Okay, so let's look at these. First one is abdominal enlargement. Where do we want to put that? Probable, because it's primarily a physical sign. And most of the probable objective changes will be primarily physical signs. So, but could it be something else?
Yes.
Yeah, it could just be fat or tumor. What about quickening?
Presumptive.
Yes. What is quickening, Amy?
Mother says she feels the baby move.
Okay, when does mother usually first feel the baby move? No? Anybody want to tell me?
6 weeks. 8 weeks.
4 weeks.
16 to 20 weeks. Now, moms who've had babies before usually feel it sooner. Is that because they move sooner?
No.
No, because they felt it before and they know what it feels like. Because when it first happens, you don't, unless you're really paying attention, you don't know. Because it truly does feel like a little gas bubble. You know, like a butterfly flutter. It's not like a pow, pow, pow. We're talking about something that's very small here still. Well, at 16 weeks, like 18 weeks, about the size of a pen, so 16 weeks, you know, we're talking about a little teeny thing here, okay? So 16 to 20 weeks. Why is that significant? Because when your mom tells you on the phone or in the office, oh my gosh, I haven't felt my baby move, I'm scared to death. You need to know how far along they are. Because if she's 12 weeks, you could say, it's fine. Nobody feels that. It's fine, okay? However, if she's 22 weeks and she hasn't felt her baby move, then we're going to need to do some investigating because why? Because that ain't right. Okay? Doesn't mean her baby hasn't moved. Maybe she hasn't felt it. Okay? Not everybody's real in tune with your body. But not feeling it at 22 weeks is outside the range of normal. And you need to know normal. What about fatigue?
Presumptive.
Could it be anything else besides pregnancy?
Yes.
Fatigue is really big in pregnancy, especially the first trimester. I mean, just almost overwhelmingly, like you just want to go and take a nap. But it could be that you are a parent, a partner, a full-time nursing student, and a full-time employee at the moment, which many of you are. So, yeah, you're probably tired, no doubt. Urinary allotment. It's probable. And that's where you, the examiner puts their fingers in the vagina, taps on the cervix, and nothing happens then, but what they've done when they tap is this baby that's floating around, they've made the baby float up, or the fetus, and when it comes back, boom, it touches your fingers. But that's kind of what it is. So if the fetus is here, you tap it, it goes up, floats, and then comes back. My grandson was volatile when my daughter-in-law was 6 centimeters dilated. Hence a C-section. Is that normal? No. At 6 centimeters, his little fat head ought to be right down there in the pelvis. But he was volatile still. And all you know is that's not normal. He should have been coming down while she was dilating. Now, to move them along, what they usually do is rupture their membranes, but very risky to rupture membranes of a volatile baby because the cord can fall out first. So very high risk. If you do it, doctor didn't want to do it, and they don't usually want to do it, you know. You can't make them. You could, but you can't. Okay, urinary frequency.
Presumptive.
Yes, so remember to associate that also with the other signs and symptoms of a UTI to make sure. Many women, once they find out they're pregnant, they have not been doing this before, but now, boom, they're drinking those 6 to 8 glasses of water a day. So are they voiding more than they were 2 weeks ago? Yes, because they are on the healthy track now. We're going to drink water and eat vegetables and we're going to walk every day. And so now they're on a different track and they are peeing more than they used to just because they're drinking more water. Okay? Fetal movement felt by the examiner?
Positive sign.
Positive indeed. Hagar sign.
Probable.
Probable. What is Hagar sign?
That's when the lower
Softening of the lower segment of the uterus. And that's felt vaginally by the examiner. What about, what's next? Chadwick's.
presumptive.
Probable.
According to the book, it's presumptive. I probably would have said something different, but we're going by the book. So
Chadwick's
please put
is-
Chadwick's in the presumptive category.
Yeah, I have to erase it because I thought it was objective.
Megan said we had an argument about it. I don't remember.
We'll say,
Totally argue about it.
We might have had a discussion.
Chadwick's sign is a bluish purple.
But we had a discussion because I, like some of you, thought it was probable, but again, this book throws me curveballs all the time, so. And we are gonna go by the book.
I'm going by the book now.
Yeah, Chadwick sign is presumptive. And what did we say it was?
So what?
It's
Hold on a
the
second.
bluish purple's discoloration.
Of what?
Due to increased vascularity.
And the cervix.
Cervix.
So how do I know?
And the
How am I
labia.
gonna tell you, hey, listen, I got a bluish tinge
You know
to
why?
my ear.
Because usually
I was looking
presumptive
at you.
signs are subjective, but they also are the least reliable. Subjective, presumptive signs are least reliable, and objective, probable are mainly physical.
This is BS.
I can't disagree, but please memorize it in that order, okay? So Chadwick sign is the discoloration, the bluish tinge of the vagina and the cervix because of the hypervascularization. So it's not changing colors, it just has a whole lot more blood vessels there. So instead of looking pink like the inside of your cheek, now it has sort of a bluish color because there are lots of little blood vessels in there. And red and blue or purple, kind of makes blue or purple.
Hey, it's blue.
I don't know anyone who regularly looks at their own, but
I have a question. Would it feel differently so that the woman can report it? Because
the Chadwick sign would not feel differently.
Oh, okay.
Hagar's, if they're doing a digital exam, it would. Again, I don't know anybody who does that exactly. But. What about darkening of the areola? Presumptive, right. And what about Goodell sign?
Darkening of the areola.
And what is it? Softening of the
Cervix.
cervix. When does the cervix get soft? As soon as you're pregnant, it starts softening. Does it always remain soft? Yes. Does it get softer? Yes. Normally, a cervix feels kind of like the end of your nose, cartilagey feeling, although it's not cartilage, but it's sort of firm like that. Later in pregnancy, it gets kind of soft, or, in pregnancy, it gets soft. So when you touch it, it's smushy. When they're in labor, you touch it and it's like just, nothing, like, okay? But it softens from the progesterone and the estrogen, and it softens. So, Goodell sign. Now, those are a lot of different words. So one way you can remember Goodell sign maybe is, does anybody know the Good and Plenty candy? Well, this is good and soft. Well, that's how I do it. It's like one of the three. Now you don't have to memorize what it is because you can memorize that. Good and soft instead of good and plenty. You know? Okay. Uterine souffle? No, I took that off. Never mind.
Souffle?
Oh, it is. It's on the, all right. Okay, probable. And what is that?
Like a blood flow. Smell is false.
Yes. Positive pregnancy test?
Probable.
Why is that not positive?
It's because you can get a false
You
positive.
can get a false positive. There are actually some tumors and some other conditions that can give you a false positive. What about amenorrhea? What is amenorrhea?
No period.
Right. Is it normal to miss a period?
Oh, that goes under. Oh.
No. Is it okay if you miss just one? And I'm talking about non-hormonally people, and people who are not on contraceptives. Is it okay to miss just a period? Probably. But because it can be with stress, etc. Okay? However, if you continually, repetitively miss periods, that can be a warning that something is wrong and can be a real health issue. Okay? But amenorrhea just means you've missed a period. Obviously is a sign, presumptive sign of pregnancy. And ultrasound of the fetus? Agreed. Fetal heartbeat? Braxton Hicks? Probable. You can pick up a Braxton Hicks by palpation. You can pick up Braxton Hicks on the electronic fetal monitor. But remember, they don't change the cervix and they don't change the behavior of the mom. In that she's not like getting more and more in pain or not. Palpation of the fetal outline? That's all it is? It's just probable?
Yes? Because it could be a fake baby with hair.
Could be a tumor,
Yeah, or a tumor.
a big one, obviously, but a tumor. Melasma,
Probable, presumptive.
your book says it
It is
is,
probable.
says it's presumptive.
Oh,
The book says it's presumptive, because it's least reliable. I agree with you, it's physical, but it's also one of the least reliable signs. So besides presumptive, subjective, you could add this. Why don't you add this? It might help you. Presumptive, subjective is also least reliable. Probable, objective are mostly physical. Notice it doesn't say all physical. And positive, diagnostic are, could be nothing else. Right?
what did you say for objective?
Mostly physical.
Mostly physical.
And nausea and vomiting?
Presumptive.
Yeah, so what else could cause that?
Everything.
Yeah, nerves, flu.
Taking a test.
Okay, all right. So study those. Now, a lot of these questions are not going to be based on just tell me what this is. It may be asking you
SATA.
to respond to a patient's question about it or whatever. So really from this, and I'm not giving anything away because I haven't picked the questions yet, you need to know what are they, what do they occur, when do they occur, if there's a time frame, such as quickening, there's a time frame. Anything else have a time frame? Maybe not, but so know what they are and what's the impact. You know, when do they occur and what does it mean? Okay? So it won't be just a simple question like what is it? It'll probably involve a patient. Okay? Most all of my questions will have two things always in it. A patient and a nurse. Because that's the way we're supposed to write questions is you have a patient and you have a nurse. If you don't, you probably, and you could even still have knowledge level then, but you're less likely to make them knowledge level. Okay? And at the end of the third semester, we should not be having very many knowledge level questions. And my goal will be not to have very many on that exam. Doesn't mean you don't have to have it. It means I don't care about that. I know you're going to learn that. I know you can memorize that stuff. I want to know, do you know what to do with it? What does it mean to your patient? What does it mean the nurse is going to do with that piece of information? That's called critical thinking. Those are thinking questions. Is that different than you had before? No? Okay, good. Great. Okay. Wonderful. Okay, so let's move on. So during the antenatal period, what does the nurse do? Well, the nurse is going to educate the patient. Boy, isn't that one of like our primary things we do is educate the patient. We're going to educate them about danger signs. And I think there might be a page number or something on there.
We need our,
Oh,
we need our
258.
screen up.
Oh, thank you. Thank you, Sasha. Page 258 is a box of danger signs, right? You see it? Is it a yellow box? I can't remember. Got that? Know that box. Now, look at that box. Kind of like the people we're going to recommend to have genetic screening. In that box are some signs and symptoms that are danger signs. That means they're reportable by the patient. That means we're going to assess them. We're going to teach our patient. Call us if this happens. This could be danger. Doesn't mean it is, but it could be. But if you look at them, they're pretty common. They have high fever. They have a gush of fluid. They got smelly fluid. What else is on there?
Vaginal bleeding with or without discomfort,
There you go.
pounding headache.
Change in fetal movement. So those, a lot of those are pretty common sense. If you read the list and you're like, oh, I would know that ain't right, that ain't right, that ain't right, that ain't right, then I wouldn't spend much time studying the box. I would just know that I need to go and look and see would I recognize those. You understand what I'm saying? Because I think you don't have to memorize them. I think most of them look abnormal. I think there's a temperature on there. Is it 101?
It doesn't know.
There's a temperature. Are you sure?
It says chills or fever.
And then it does define fever?
I mean, we know what.
The fever is usually
It's more than 100.5.
but it doesn't say in the box.
Ah, okay. Okay, I'll have to make sure I don't include anything like that. Okay. So we're going to educate about the normal changes in pregnancy. What are those? Oh yeah, one off, sorry. What are those? Everything that we just talked about. the normal changes about increased frequency of urination, about increased amount of cervical mucus, the changes in the breast, the absence of periods, all those normal signs and symptoms. Now, we're not going to sit down and have a little class like we just did, but you're going to teach your patients in the antepartum period as we go along. Again, we don't really get to see patients in the antepartum period. We see them in the hospital, so we probably won't even encounter this in clinical. And then medications, it's coming. Medications during pregnancy, and I think I have a website which is blue, which you can't see at all. There are a lot of references for medications in pregnancy. Ideally, every pregnant person who takes any kind of medication, prescribed, non-prescribed, or over-the-counter, would go and visit their primary care or OBGYN and say, I'm thinking about getting pregnant. This is what I'm on. Is that okay? And then we would, if they're on something that's not okay while they're pregnant, but there's another class of medications that could treat that same condition while pregnant and be safe, they would be switched to that. But remember, 50% of the people don't plan on that. So there are 50% of the people, women, who might be on a medication that's completely unsafe. Or like somebody I know who was on an unsafe medication for type 2 diabetes who suffered a miscarriage and then decided to listen to her mother-in-law and get on insulin, which is safer during pregnancy. Even though she was not insulin dependent, insulin is a large molecule that does not cross the placental barrier. And so it's safe for the fetus. So that's why if you're on certain meds, you need to come off of them. Now, it's not pleasant to go on insulin, is it? You got to be regimented, you got to check your blood, you got to poke yourself. We probably wouldn't mind poking ourselves because we know it's the teeniest, tiniest little needle, but not everybody feels that way. Okay? There are websites here. You can, I'm just showing you for instance. Here's the FDA. They have a text for baby thing as well. But all kinds of places just showing you there are resources, okay? Support and listen, monitor for problems and complications. And we'll talk about more of those later. You could be monitoring for the danger signs. So you may be asking your patient, is your baby moving? Because babies should move. They do sleep, but they should move. Refer. Can nurses refer without a physician or a healthcare provider? Yes, you can. You can refer, even in tertiary care centers. You can refer to dietitian, nutritionist, you can refer to social services. Some things you would need a healthcare provider. So maybe for pain management, and pain management may be a very big deal for some of our clients and patients who are substance users, because you and I take one Percocet